Please read through the next few slides for the chapter objectives and the introduction. Bones make up the skeletal system. The skeletal system aids in the movement and provides support for and protects organs, synthesizes platelets and red blood cells and white blood cells, and serves as a storage depot for minerals, such as calcium. The skeleton is composed of connective tissues including bones, cartilage, tendons, and ligaments. Bones are made up of a periosteum that surrounds compact bone, which in turn surrounds trabecular bone. Bone marrow, the innermost part of the bone, resides within the trabecular bone. The human skeleton contains 206 bones. It is divided into two main parts, the axial and the appendicular skeletons. The axial skeleton consists of the skull, vertebral column, and the rib cage, and is composed of 80 bones. The appendicular skeleton consists of the shoulder girdle, the pelvic girdle, and the upper and lower extremities, and is composed of 126 bones. Bone is composed of organized living tissues. 65% is made up of inorganic material known as a mineralized matrix. The other 35% of bone is organic material, most of which is the fibrous protein collagen. The two basic tissue types of bones are trabecular, known as spongy bone, and cortical, known as compact bone. Bone tissue is arranged in an organized manner. A thin membrane called the periosteum surrounds the bone. It contains connective tissue with many blood vessels and nerves. Below the periosteum is the cortical bone or the compact bone. Bone tissue cells are osteoprogenitor cells, osteoblasts, osteoclasts, and osteocytes. Osteoprogenitor cells are stem cells that are located in the bone marrow, and they play a role in bone repair and growth. These cells will later differentiate into the more specialized bone cells, such as the osteocytes and the osteoblasts. Because bone is a living tissue, it adapts to mechanical stress via the remodeling process. Bone remodeling is just bone metabolism, and this is a lifelong process where mature bone tissue is removed from the skeleton, a process called bone resorption, and new bone tissue is formed. This is sometimes called ossification or new bone formation. These processes also control the reshaping or the replacement of bone following injuries like fractures, but also microdamage, which occurs during normal activity, including exercise. Certain nutrients are required for bone metabolism or bone remodeling, and these are calcium, phosphorus, magnesium, fluoride, vitamin D, and vitamin K. Bone remodeling occurs in 4 steps: activation, osteoclast resorption, surface preparation, and building new bone tissue. Please watch the video on the next slide regarding bone remodeling. Bone mineral density is a measurement of bone tissue, and it positively correlates with overall bone health. Think of it as the total amount of bone mass in a given area. When your bone mineral density is high, your bone strength will be great. Bone mineral density measurements can help predict the risk of a bone fracture or osteoporosis. The DEXA machine is a clinical tool used to assess bone mineral density. Calcium is the most abundant mineral in the body, and it has 4 primary functions: to make bones strong and healthy, to facilitate nerve-to-nerve communication, to stimulate muscle contraction, and to activate blood clotting factors. Other benefits of calcium in the body include decreasing blood pressure, preventing colon cancer, and blocking kidney stone formation. Blood calcium levels are rigorously controlled by the body. If blood levels of calcium drop, the body will rapidly respond by stimulating bone resorption, thereby increasing stored calcium into the blood. Therefore, it's important to consume calcium-rich foods to sustain proper dietary intake of calcium. The levels of calcium in the blood are controlled by three hormones. PTH will increase blood calcium levels. Calcitriol will work with PTH to increase blood calcium levels. And calcitonin will decrease blood calcium levels when the blood calcium levels get too high. The daily recommended intake for calcium for adults averages from 1,000 to 1,200 milligrams per day. The regulation of calcium is a typical negative feedback loop. If there is not enough calcium in the blood, this will stimulate the release of PTH. This will cause calcium to be pulled from the bones, kidneys, and intestine into the blood with the help of activated vitamin D. The result is higher calcium levels in the blood, so this will shut off further PTH release. Most Americans get their calcium from dairy products, primarily cheese, but foods fortified with calcium such as cereals, soy milk, and orange juice also provide a third or greater of the recommended daily allowance of calcium. And although most Americans rely on their dairy products for obtaining calcium, there are many other good non-dairy sources of calcium. The percent daily value of calcium is given on the nutrition facts panel on food labels. To convert this percentage to milligrams, you just multiply this number by 10. This is the amount of calcium in milligrams in one serving of this food. This can be done easily, but only for calcium and not for other nutrients, because the daily value for calcium, based on the recommended daily allowance for adults between the ages of 19 and 50, is equal to 1,000 milligrams. Not all of the calcium in food is absorbed by the body. Vitamin D and estrogen enhance the bioavailability of calcium in the body. However, diets high in oxalates, certain types of fiber, and diets that don't contain enough fat in them will decrease the bioavailability of calcium. Vitamin D is essential for maintaining calcium levels. Once it's activated to calcitriol, it acts in concert with PTH to keep blood levels of calcium constant, especially by enhancing its intestinal absorption. High levels of vitamin D in the blood promote bone health. For adults, the recommended daily allowance is 600 international units, or 600 IUs, which is equivalent to 15 micrograms of vitamin D. One thing to note is that the National Osteoporosis Foundation recommends slightly higher levels, and that adults under the age of 50 should get between 400 and 800 IUs of vitamin D per day, and adults 50 and older should get between 800 and 1,000 IUs of vitamin D per day. According to the IOM, the UL for vitamin D is 4,000 IUs per day. A deficiency of vitamin D in children causes the bone disease rickets. Rickets is very common among children in developing countries, and it's characterized by soft, weak, and deformed bones that are exceptionally susceptible to fracture. In adults, vitamin D deficiency causes a similar disease called osteomalacia, which is characterized by low bone mineral density. Phosphorus is the primary mineral component of bone, and it's regulated in parallel with calcium. However, too much phosphorus is detrimental to bone health. Magnesium also helps to keep bones strong, and a deficiency in magnesium can compromise bone health. Fluoride combats tooth decay and benefits the teeth and the bones when present in the diet at the recommended intake. Vitamin K is a coenzyme that participates in the modification of proteins that act in bone tissues and promotes normal blood clotting. The table on this slide lists the nutrients essential for bone health, their function in bone health, and food sources. Recall that bone mineral density is an indicator of bone quality and correlates with bone strength. The greatest quantity of bone tissue a person develops during his or her lifetime is called peak bone mass. Excessive bone loss can lead to the development of osteopenia and eventually to osteoporosis. Osteoporosis affects women more than men, but it is a debilitating disease for either sex. Osteoporosis is often a silent disease that doesn't manifest itself until a fracture is sustained. Osteoporosis has two different categories. Type 1 osteoporosis is also called postmenopausal osteoporosis, and it most often develops in women between the ages of 50 and 70. It occurs more in the trabecular bone or the spongy bone. Type 2 osteoporosis is also called senile osteoporosis, and it typically occurs after the age of 70, and it occurs equally in the trabecular and the cortical bone. Some things that would put a person at risk for developing osteoporosis can't be changed. These non-modifiable risk factors include being female, being over the age of 50, having a small frame, having an endocrine disorder, having a family member with the disease, and being Caucasian or Asian. The risk factors for osteoporosis that can be changed are smoking, alcohol intake, physical inactivity, and poor nutrition. Dietary inadequacy, certain medications, and diseases increase the risk for developing osteoporosis. Like many diseases, osteoporosis is a childhood disease with old age consequences. The primary prevention for osteoporosis begins early in life with proper diet and exercise. The strategies of secondary prevention that focuses on treating osteoporosis aim to stop further bone loss and reduce fracture risk. Osteoporosis prevention and treatment involves a three-tiered approach that incorporates lifestyle modifications, the assessment and treatment of underlying causes of osteoporosis, and medication. Those who are most at risk for calcium deficiency are teenagers, amenorrheic women, and that's a woman who is childbearing age but is not having a period, the female triad athlete, the elderly, lactose intolerant people, those with milk allergies, and vegans. When taking calcium supplements, be sure to monitor vitamin D intake to ensure that the proper benefits are achieved. Split doses are more effective since the GI tract can only absorb up to about 500 milligrams at a time.